So welcome everybody. We are actually filming live right now on YouTube. I'm about to start my Ask the Expert conference, my Ask the Expert show on KSRO. And we're going to talk today about how we will handle being shelter in place during this COVID-19 pandemic. So hang on while I listen to the radio as we're about ready to go on the air. We're about to start. We're just finishing up on the news. You won't be able to hear the introduction of the radio because I'm Skyping while we're recording this on YouTube. But when we go live, I'm going to repeat what our host, Robin Berardini, is asking me. And so you'll know as the discussion goes on how to deal with being shelter in place as regards to just our health and about beauty. Thank you, Robin. How are you during these difficult times here in our community and in our world? Grateful. I think that's a great. I believe that's a great way to be. And I'm going to apologize. We're recording this on YouTube for our listeners later, as well as for our live audience on KSRO. And again, I want to thank them for always tuning in to us, and I greatly appreciate that every Thursday at 12:30. They don't know this, but that I'm actually in my home studio, as you are yourself, and we're being good citizens, and we're staying shelter in place, as been asked initially by our Sonoma County medical officers, and then of course Gavin Newsom, our governor, and then of course being led by what's going on in our country and in the world. As I sit here in my studio, I'm going to have to, I apologized in that there's a little bit of delay, so if it seems a little stilted in our conversation, I'm going to apologize to our listeners. Nonetheless, I'm sitting here in my office, and with the backdrop, one of our office backdrops that I had brought from my office back home, knowing that we may be shelter in place for quite a while, and again, wanting to be a good citizen. But I added to my backdrop, not only where you see multiple images of our branding logo, woman, for the Aesthetic Laser and Vein Centers, but one of my favorite sayings up here is practice aloha. And I put a couple of those stickers up there because that's really, Robin, what we need to do during this difficult time. We need to Sure. Well, I think it really just goes back to what our parents taught us, what our mom and our father, our mothers and our fathers have taught us is basically, and getting back to treating people the way that we would want to be treated. So it's treating them with kindness, consideration, graciousness, sharing, okay, protecting the weak. Those kind of things are really important. And so as good citizens here in Sonoma County, I know that we have offices in Napa and to our Napa County friends and family, as well as in Maui, where we have an office. That's very important. We've been shut down commercially, as most of us are. We've been shut down in terms of being able to reach out and to touch. And I'm one of those people who's extroverted. I like to reach out, like to hug. And so it is a difficult time for us. Nonetheless, I think that, if we put our minds to it, that we'll be able to handle this, we'll be able to practice aloha, even in our own homes, by reaching out to others. And we have such great technology now, Robin. We're able to, I'm connected to KSR's studio with you and Michael DeWald, who's our medical director, excuse me, our program director. I'm the medical director, he's the program director, and we're able to connect technologically. I'm right now on Skype, and I'm also recording on my iPad to later go on to onto YouTube. So, I'm grateful for all of that as well. Yes. Absolutely. There's no reason why, just because we're in our home, that we can't reach out to others. And I feel, in my opinion, and we're all going through different feelings, okay, where we go through maybe some bravado, some of it important to have, some of it a kind of a false bravado. Then we go through a period of hopelessness as all this negative news is coming in, and we're being inundated with that. And then where we kind of restabilize ourselves and feel fortified and determined. And I think that's where I find myself going through those array of emotions and reaction to the COVID-19 pandemic, is being determined to help others, okay? And we can help others. And I think, I used to be at the front lines with my fellow doctors and nurses and other medical colleagues and brethren, but we can also help people just on an individual basis, making a phone call. I'm going to just share with you a funny little story, is that I got a missed phone call from my good friend and colleague, Dr. Bill Mesrel, who's now retired, a retired radiologist. And so I called him back, and Bill's a little bit older than me, and I'm a little concerned because of the pandemic. And, Bill, when I called him back, "Are you doing okay?" He said, "Oh, no, I'm doing fine." He said, "I just listened to our state governor, and he said, not only should we stay shelter in place, but we should reach out to our seniors." And so he said, that he was supposed to call 5 seniors a day. So I was the 4th one that he called, and I was cracking up because I don't consider myself a senior, but I guess I am. Age-wise, I'm a senior, Robin, and it was pretty funny that that he called me. And so then I turned it around on him and I said, "Hey, Bill," that's Dr. Mesra. I said, "Bill, how come I was only the 4th person you called? You're the first person that I called." Okay, so we kind of went round and round on that. But it's really true. So it made me start picking up the phone, start calling friends, some of my colleagues, since I retired from general vascular transplant surgery, that I hadn't spoken in a while. And so we're, the baby boomers, and giving them a call and just checking in. So, do that. And it just doesn't have to also be seniors. It can be your friends. All of us are being affected by this, and we can all use an uplift in our spirit. So reach out. And that's the reason why I decided to do the show. Last week we ran a rerun just right in the middle of the shelter in place order. So it's a little difficult to put this together, and I wasn't sure whether to go ahead and to do this, and I decided, you know what, we need to reach out to our community. So Robin, I thank you. I know you were on sabbatical. You've just gotten back into the country. I'm glad to hear that you and your mother are safe at home, safe shelter in place, and yet we're still able to reach out to our listeners who are our friends. Well, thank you. And so I know today we wanted to talk about what should we do. So although now I'm a cosmetic surgeon, and of course we're going to talk about cosmetics as well, uh, part of cosmetics on how we are on the outside really starts from how we are on the inside. Okay, I may, and I'm on YouTube. Usually, I'm dressed up. I have a suit on. I have the tie or my lab coat on, and looking very medical professional. And now being shelter in place, I have my. By the way, support local. I've got my badass coffee T-shirt underneath, which you can't see. I have I ordered from Mary's Pizza yesterday, and so forth. So please try to support our local community, those that are there to serve us. Having said that, I think it's important that we not wake up. And I know there's a big joke going around social media where we're going to change from our day clothes into our night clothes, excuse me, our day pajamas into our night pajamas, and then back and forth. And I think it's really important for us to wake up with a purpose. One thing that's become more evident to me, Robin, is that with this pandemic and being just shelter in place for, geez, only moving into our second week, really mid-second week, is that I know I'm never going to retire. I just know that I need a purpose in life. To I need to be able to do something for the greater good for mankind. And being a cosmetic surgeon, what is it? It's our mission statement is to help people to improve their self-confidence by enhancing their self-image through advanced technology in a warm and secure environment. And so that's my mission statement. And in part, it's also part of my mission statement of life. So what we want to do is, in my opinion, is that we need to get up. Okay, so once you get up, we all know exercise is good. And exercise can be something very simple. It may be walking around the house. It may be taking a short walk outside of our home. Walk if you have a dog, and oh my gosh, my poor dog is getting too many walks during the day. But walk your dog outside. I'm lucky enough to have a stationary bike at home, and I kind of pull it out into the patio, and it's when it's a little bit sunny, and I sit out there and do a little cycling. So get your endorphins going. So just get a little bit of exercise. Then, secondly, is get ready for the day. So, besides showering, okay, getting ready for that, put on some clothes. I'm not going to put on my suit, my tie, all those kind of things, but certainly get dressed so that I am ready for the day, so that I'm not just sitting there in my pajamas at home. Okay, so, and I know that some of you are taking care of your family and so forth, but I think kind of giving them a routine, giving your children routine. I've had kids, now I have a grandson. Giving them a routine is very, very important. So those are the kind of items that you can do. Eating healthy, okay? I think that's going to be important. As best we can, let's try to eat healthy. Those are all important items that we can do so that we feel good on the inside, which is going to make us look better on the outside. And do a good deed. Make that phone call. If you're running to the grocery store and you're going to get something, maybe call a neighbor to see if they need something. Those are all really positive things that are going to reflect well upon ourselves. So that, in terms of just some general physical, medical, and spiritual well-being, that's what I would recommend, Robin. You do. You do feel better. So, for our YouTube listeners, I'm just going to repeat this, sorry, to our radio listeners, is that Robin Berardini, who is our host, just made the comment about these are simple steps that you can do, and that she was in her pajamas before we were about to go on the air, decided, I'm going to jump in the shower. She got ready, put on some regular clothes, day clothes, and she just feels better. So that's important. Now, let's talk a little bit, because that's where we want to go. Let's talk about what can we do for our in terms of our beauty, our cosmetic aspect. And so number one, let's just start with our skin. And let's not ignore it. So washing your face. Let's not get into those doldrums on don't even wash your face in the morning or at night. Now, if you still have our cleanser, our healthy, different cleansers that we carry, use those cleansers, okay? You don't have to scrub. We don't want to take away all the natural oils and irritate your skin, okay? But just wash your face and just use lots of water. That's important just even with our hands. With our hands, we don't want to be scrubbing so hard. I know we're doing our 20-second routine, which I think is great. I've always followed that, but we want to wash our hands. And then it doesn't have to be hot water, okay? We found that just moderate temperature, tepid water will actually help to wash away bacteria, viruses, those kind of things. So just wash your face, okay? And if you don't have the products that we have, we can talk about that later, how you can get them from our office. But if you're going to be using soap, then you just use a little bit. You don't have to use a lot. And again, it's going to be a lot of water to help to just sort of rinse away pollution and debris. And I think that there are a lot of people, especially the female listeners here, who probably aren't wearing as much makeup now because they're at home. So it should be a little bit easier to cleanse. So that's going to be the first thing to do, Robin. That's correct. So Robin just mentioned to our YouTube listeners about just repeating again what we said. So wash your face day and night, use tepid water, try to use your products if you have them, don't scrub too hard. So that's going to be important. So now, Robin, what is the key? So a couple of simple things that we need to do. If you're fortunate enough to have your medical grade cosmeceuticals, then what we would do is have you go through your routine. You still need to nourish your skin. If you are beginning to run out of them, you can actually contact our office. Just call our office number, and you get that from our website, and dial extension 305. Extension 305. That's going to go 305, and that's going to go directly to Dion, who's our practice administrator, and we're going to be just checking, and again, keeping social distancing. Check those ever so often, and it won't be every day, just so you know that, because we're trying to all stay shelter in place, and then we'll try to get those products out to you and contact you. So we can do that. But whatever you have at home, probably the number one item, if you can tolerate that, would be retin A or your retinols. Retin A or your retinols. So that's going to be important to put on your face. And if you can put that on in the evening, well, the reason that is, it's been, one, it helps exfoliate, because we don't want your skin to look congested or to be congested. It's just not looks here. We're talking about health of your skin now, Robin. So we don't want your skin to be congested. We want it to be exfoliated. And so one of the most powerful exfoliants that we have is the retinol or the retin A. Okay, so that's going to be number one. Then a moisturizer, and it's the same thing for our hands. We're washing our hands so much now, and almost in excess, if you will, because of the pandemic. And we don't want to spread germs, and certainly not the virus. So what you want to do is, while your hands are just lightly moist, and this is actually recommended from a dermatologic journal that I subscribe to, or your face is just slightly moist, take your moisturizer. Take your moisturizer and put it on, okay? So the moisturizer is going to have its own emollients that's going to help to moisturize your skin, but also what it's going to do is going to help to trap some of that moisture that a little fine layer of moisture on your face or on your hands, and help to keep that in place. So moisturization is very important, okay? So exfoliation and then moisturization, those are two steps. And then lastly, Robin, where we want to go with this is that we would want you to still put on sunblock. So I still put on sunblock, okay? And you say, well, wait a minute, I'm shelter in place and we're in the winter. Well, we're in Sonoma County, so surprisingly, we've had some nice sunny days, and we've even had some sun even on our rainy days. And you're going to be by a window, and I'm kind of pointing on to our YouTube listeners, because there's a window, there's some warm light coming into the studio, the makeshift studio that I set up, Robin. And you're still going to get the harmful UV rays that are coming in. So go ahead and put on your sunblock in the morning, certainly. And if you're going to go out in the backyard, go for a walk, put it on again. So those are still going to be important, okay? So prevention is still going to be important. So we're going to get through this pandemic. We're going to get through it together. We're eventually going to return back to as near normal life, as daily lives as we can. And you're going to start coming back in, Dr. Tom, or to our nursing staff, our wonderful nursing staff, I'm seeing this, and this. Well, prevention now, and probably the least expensive thing you can do that can help you, is putting on sunblock. So again, put on that sunblock to protect your skin, because we're still getting the harmful rays of the sun on our face, and that's going to be important to try to mitigate the UV damage. It is because we think, oh, I'm just in my house. I don't need to do that. It's something that we should do. And it's so funny. I'm just, as I should tell you, and as I'm talking to our YouTube listeners as well, as I'm thinking, okay, I'm going to put on, and I use a zinc oxide. And, how much do I put on? I don't want to look like a white ghost when I'm I'm on radio, but here, and I'm talking to our KSR listeners here in Sonoma and Napa and Marin counties, even up in Mendocino, but I'm not wanting to look like a white ghost. So, I definitely put on sunblock, but I'm just sort of laughing at myself as I'm getting ready because I'm filming this as well for our YouTube listeners. Yes. Yes, I know that you were in a warm climate area when you were on sabbatical for a while, and you certainly deserve that. I'm glad you got away, Robin. But those who have mineral makeup, and we in particular carry color science in our office, the mineral makeup is fantastic because you can put it on, you look good, it helps to cover up maybe some areas that you want to have cover up. That's what makeup is. But also it has minerals that are physical blocks to sun and to the UV rays. So it's thank you for saying that. That's really important to use if you have a mineral makeup, is to go ahead and to use that and apply that multiple times during the day. And so you are correct. It looks great. It's easy. I'm again mentioning that for our YouTube listeners, and we know that when we look in the mirror, when we look good, we feel better, right? I mean, you sit there, you put on your new blouse or your new dress or whatever it is that you have. You kind of look in the mirror and you feel better. So, we're also trying to help ourselves. So this is what we're doing. It's what we see in terms of dealing with being shelter in place. So I do feel that routines are important. Healthy routines are important. Get up, take on the day. We all have projects, whether it's taking care of our family, whether it's trying to take care of a business. So many small business owners are struggling right now. We're a small business. We're struggling with the same struggles. What we want to do is get ready for the day, have a purpose. I feel like if we have a purpose, and part of that is making ourselves be presentable for the world, if you will, that it will do us good in our souls and help us to get over this difficult time that we're all undergoing in our communities and the country and in the world. We are now on a break here, and so we'll be right back. There may be a little pause here. I apologize for that, but we'll be back on, and I'll let you know. Again, this is just a live filming. Hi, Robin. Okay, how much time do we have? Or Michael, how much time do we have? Okay, so we have 5 minutes coming back. Alrighty, so we'll be ready in just a little bit. I think, and Robin's asking me about whether we should recap the last segment. So you're getting a little glimpse into how we do our radio show. Robin, normally I think that's fantastic to do, but because we're also sharing this to YouTube and they're not going to be able to hear you, let's skip over that portion because you're not on. They can't hear your voice on our YouTube recording. Let's skip over that, and why don't we move into the day is going to be where we're going to be, no, the shelter in place is going to be lifted. We're going to be ready to start with our daily routines, and we're coming into your office. What is your prediction? Maybe that might be the way to go. So we're going to talk about my predictions for when this is lifted and what we can do, and maybe what's going to be the best bang for our dollar. What should be our priorities in terms of coming back and starting to take care of ourselves, both health-wise and both from a beauty perspective as well. Thank you. Oh, we're up in 40 seconds, so 5 minutes went by. Oh, we're going to have 5 minutes. Is that correct? Okay, 5 minutes left. Okay, very good. Thank you. No, this is not going to last forever, Robin. I agree. It's not going to last forever, and we'll eventually get back to our daily routines when the shelter in place is lifted. Okay, so Robin, you want to know what are my predictions when the shelter in place is going to be lifted? Get back to our daily lives, okay? Well, nothing really changes, okay? We're gonna want to just carry on with our routines. I sometimes equated that. We've just been through some horrible fires. I lost my home in the 2017 fire, and we talked about that we're like the animals on the Serengeti. Something comes through, sweeps through, and it is devastating in many ways. And then what do we do? What did those animals do in the morning? They all get up and they all go down to the watering hole. They all do that, okay? And that's what we do. So we're going to get back out there. We're going to want to start living again. So one of the things that I think are going to be really important is that we're going to be patients are going to be coming in for skincare. So that's important, okay? So one of those will be I really feel will be chemical peels. As good as we're trying to take care of our skin's going to be congested. Come and see Haley, our medical esthetician, and we have a whole host of ranges of peels for you. That's going to be, in my opinion, one of the number one requests. Number two, absolutely, hands down, Botox and the other Botox Dysport that we have. Okay, so Botox, for those who know what that is going to be the neuromodulator, which is going to soften frowns. Okay, we've got frowns, we've been worried, we've been anxious, frowns, crow's feet, our forehead lines. The Botox is going to work very well to help to soften those areas. We don't want to get back to the world and look heavy in terms of our thoughts, in terms of maybe looking angry and depressed. We've mentioned in the past about a social science experiment where they took clinically depressed patients. Half of them they gave Botox, the other half they didn't. They sent them out into the world. They came back and retested them. Those who had Botox were less depressed. And Robin, it's just like I mentioned earlier in the show about looking in the mirror. When we see ourselves looking good, we feel better, okay? So it's the same thing when people are interacting with us, Robin. When they see us frowning, they respond to us differently. When they see that our faces are softer and smiling and more inviting, more gracious, welcoming them in, look with more aloha, that's what they're going to see, and they're going to respond to this, and we all need that lift. And so it's interesting that that's what Botox and Dysport can do for us. And in fact, I've had multiple requests on social media and text messages, and people even asking some of my family members, hey, can I get in to get Botox during this time? And Robin's laughing right now to our YouTube listeners. I have to unfortunately tell them, listen, I'm being a good citizen. We are shelter in place. There is no way that you can do cosmetic procedures and be, and actually keep safe social distancing. So I apologize to those who want to come in. We've had to cancel cosmetic surgeries. We're not sure when we're going to get back, but when we're back, we're going to be loaded and ready to help all of our patients, our friends, family members are lining up as well for those treatments. Practice aloha. Thank you. So we just finished the show. I want to thank you. I know there were some pauses in between when Robin Berardini was asking me questions. I try to repeat them for you. Please, everybody, during this pandemic and shelter in place, please, please, please take care of yourself. By taking care of yourself, reach out to others. Helping others takes care of ourselves personally. We talked about how to take care of our skin, sunblock, daily routines, and when you're ready to come back to our office and meet up again with us, we will be very grateful to you and ready to take care of you as well. So thank you. Practice aloha. Take care. Thank you.